Hello, Colusa County. Many of you know me, Dr. Greg Burt. I'm your local county health officer. Wanted to take a few minutes of your time today to discuss some of the issues that you may be hearing about on the news related specifically to COVID vaccination. Lots of questions and concerns circulating from people in the community, patients that I take care of here locally regarding safety and efficacy. So I want to just take a few minutes to be addressing those things. Then spend a couple of minutes talking about the county's vaccine allocations and plans that we're working on to try to get as many people vaccinated as we can, as quickly as we can. As I'm sure most of you know, the vaccination rollout has been much slower in the state of California than I think most people would have wanted, largely related to supply chain issues from the manufacturers. States and counties are allocated vaccine largely based on population. And of course, in our small rural communities, that tends to have more of an impact on us than in some of the larger communities. Currently, there are two FDA approved vaccines that are available. There's the Pfizer vaccine and the Moderna vaccine. Both of these vaccines really rely on the same technology to try to help boost the immune system and reduce the risk of getting infection with COVID 19, or in patients who do happen to get infection, to minimize the infection as to avoid a hospitalization and a serious illness. The technology and the science behind these vaccines has been around for the better part of a decade. In general, these are highly effective vaccines. They are quite safe. We have a lot of knowledge and data on these particular types of vaccines. And so when I hear patients rightfully questioning safety, I would encourage all of you to be having those discussions with your primary physicians, but leaning heavily on favoring vaccination for most, if not all, individuals. As with most vaccines, we will learn more about them as more and more people get immunized. And I believe that the goal, if we can achieve a population vaccination rate in the 80 plus percentile range, we'll be in a much better position to be able to go back to life pre-COVID in terms of eating at a restaurant and not having to wear a face covering when you visit friends and family. After vaccination at this point in time, especially for our over 65-year-old patients, it is still encouraged to continue to wear your face covering. We just don't know yet how effective the vaccine is necessarily going to be in certain population groups. We know that people can still get infected even after vaccination, and so potentially people can be a vector for spreading disease. And because we have a large percentage of the population that's still not been vaccinated, particularly true for our over 65-year-old patients or those with underlying medical conditions, very important to continue to follow the public health guidance, physical distancing, hand washing, and face mask wearing, very important. The mechanism that the county is utilizing right now to implement vaccine is to really be encouraging patients to be following up and contacting their primary care providers. For those of you who have a primary care provider in Colusa proper, we have been pushing vaccine out to those providers. The mechanism for how those individual clinics are going to stand up their vaccination clinics should be directed towards your providers. For those who have out of county primary healthcare providers, they should still be contacting those individuals regarding vaccine delivery. I can speak for myself that patients that I still care for here in Sutter Yuba County that are Colusa residents, we are in the process of vaccinating all of those patients. And so just because you don't live in the county where the vaccine is going to be delivered is not an automatic no to getting vaccinated. For those that do not have a primary care provider, especially our over 65-year-old patients, now is a great opportunity to be researching that. I know there are several facilities in Colusa that are accepting new patients Indian Health, Ampla, Colusa Medical Center, and Riverside, just to name a few, are the healthcare delivery platforms in your community. You should be reaching out to see what availability there is. I hope that we'll be able to give more information in the upcoming days and weeks as our supply chain stabilizes. We get a larger supply of vaccine in from the state. As always, this information that I give you today is based on the knowledge that I have today. Things will be changing rapidly in the coming days and weeks as the state moves towards different prioritizations and different strategies to get vaccinations out. Our local public health department will be continuing to update its website so that we can hopefully give you the latest information that's available on how we can try to get our populations vaccinated. I appreciate your time and your attention today. Please continue to stay safe and stay strong.